Okay, welcome to our second lecture. It is chapter 39, 40, and 41. So chapter 39 is assisting in reproductive and urinary specialty. So this is really just kind of overviewing if you work for that type of doctor, or even if you are helping perform some of these procedures that happen for these patients. So assisting with gynecological patients, you have your menstruation or menarche, you have menopause, and then we have to know that last menstrual period. With the last menstrual period, we need to know, making sure going forward, if they are possibly pregnant or if they are sexually active. So we need to make sure that we are asking those questions. We also may be doing other screenings such as HIV, chlamydia, gonorrhea, all depending on the history of the patient and that general physical exam. Now, the actual exam is done by a licensed practitioner, same with the breast exam and pelvic exam. What you're going to be doing is getting the actual speculum and setup ready. So this week we probably won't do it. We may not have time, but going forward, the next week we probably will. I'm going to show you guys how to open up one of those packs and set it up for your doctor and what they are supposed to do, making sure you set up the patient correctly, that they have that gown on or that drape, and that they are in the exam table how they're supposed to. We may be also assisting, especially with education in prenatal care, may even be kind of introducing what to expect during labor, during delivery, if they're going to breastfeed, bottle feed, and then at postpartum stages after the baby is born. We do want to really hone in on if they do want to breast or bottle feed, so we know, are we going to be talking to them about breastfeeding, when the milk is going to be coming in, bottle feeding, what to look out for if the baby isn't really reacting very good to the bottle feeding, and then our postpartum care for that mom, making sure that they are going to their appointment, that they are not lifting, especially if they had a C-section, things like that. So we'll talk a little bit more about when we're in the skills lab of how to talk with these patients. So some tests that you may be performing with in the office is pregnancy tests. So we're going to kind of go over that. I don't have any, but I may be ordering some so we can kind of practice a little bit. Tests for sexually transmitted infections, you may have to assess in mammograms. And there's also fetal screening. Now, a lot of those are done in like the hospital setting, in like radiology and in the lab portion, but it's just something that you may see depending on how big the practice is for the doctor. Our invasive procedures, so we are going to set up for a pap smear. You may get to see an amniocentesis if you ever work for OBGYN. Other invasive procedures, you have your D&C. This is where they're actually going and kind of cleaning out the uterus and cleaning out the cervix if say someone was pregnant and they had a miscarriage. And then we have our abnormal bleeding. We have uterine, menstrual, we have spotting, postmenopausal. We have different things that may happen. Embedding that IUD, so in placing that IUD in. Other invasive procedures that you may not get to see is hysterectomy. A LEAP procedure, unless you are that type of MA that goes into the surgical suite with the physician, or maybe the physician has a surgical suite right there in his office and you are part of that surgical team. So assisting with that general exam, we do want to collect and process urine. That's the first and foremost in gynecology, or this is urology now. We want to get that urine sample right away. We are going to also take blood and other specimens if needed. May have to obtain cultures, and then we're going to really participate in that patient education. Now, in order to work for a urologist, you really do need to understand that urinary system. Most urologists will take you on and they will train you themselves. Now, you will have that basic knowledge of medical assisting, but they're going to train you in their specialty. So other tests and procedures, you have urine and blood tests, you have semen analysis, this is what we do after someone has a vasectomy. Now, some common diseases of the reproductive or urinary system is cancer. You can have ectopic pregnancy. That's where the egg implants into the fallopian tube. Endometriosis, You have menstruation disturbances, so you have your amenorrhea, dysmenorrhea, monouria, all of them have a definition. So your amenorrhea is absent of menstruation. So please make sure that you do read all of those. You can have pelvic inflammatory disease, polyps, vaginitis is inflammation of that vagina. You can also have impotence, incontinence, kidney stones when it deals with the urinary, and then and sexually transmitted diseases. So that is it for chapter 39. We're going to move on to chapter 40. Let me get to it real quick. Okay, so chapter 40 is assisting with pediatrics. So really in a pediatric clinic, we have to know how to do proper vital signs, proper measurements. We do need to know a little bit about their developmental stages and care. So like our neonate that birth to 1 month, some of their physical developments, intellectual, cognitive, and social development. So we know kind of where they're sitting at. You know, normally with newborns, they're calm when they pick them up or whenever you kind of swaddle them. They do respond to stimulation. Lotions and powders should be avoided with neonates because you don't know if they're going to react with them. Now we have our infant. Normally they do develop really rapidly with that first year of life. Before the first month, the baby should be kind of focusing on things now, kind of following things with their eyes. They tend to start maybe babbling a little bit about 2 months. Around 4 months, they're rolling, maybe even playing, kind of holding toys in their hands. By 5 months, they can have like a bottle. Normally should be holding it by themselves, maybe 6 months. At 6 months, you will kind of see them kind of trying to sit up. Their teeth may start coming in. And even between 6 months to that year is where they normally do tend to start talking. We have our toddler. Usually in this stages, their weight really doesn't go up that much. They do become a little bit more independent. They want to do everything themselves, especially like feeding themselves. By the age of 3, this is where they really can run, throw a ball, maybe even earlier than that too. They can draw simple shapes. They kind of recognize things. And then normally around this time is where you're potty training. They're also talking in full sentences. You have your preschooler. This is where they are starting to learn a lot more of their learnings. Their vocabulary has increased. They know simple shapes. They know colors. Normally by this time they can write their name, and they even have maybe started to even read a little bit. Then you have your or middle school is 11 to 13 years old. This is where puberty starts. Oh, sorry, no, we have your elementary school. It's our 6 to 10-year-olds. They, around this age, normally like their baby teeth starts to fall out. They are influenced a lot by their peers. They want to like fit in with everybody. You have your middle school. This is 11 to 13. This is where your puberty does start. This is where their adult characteristics do start to come in. Their hormones do start to change. Then you have your adolescents. This are 14 to 19-year-olds. This is where they do tend to get a little bit more of their height. Girls do put on a little bit more weight during this time. They want more of that authority figure. They want to be more of their own boss. They may be more socially accepted during this time, depending on where they're at with friends and things like that. Normally at this age, they do have a lot of weight on their shoulders too, because at this time they're in high school, they're working to go to college, or they have a lot of schoolwork. They have a lot of weight on them, so they tend to have a lot more anxiety. Now, our well child examinations, there are 7 of them during the first year, checkups at 15, 18, 24 months, and then 30 months. Then you have yearly checkups after that. You do have immunizations that are recommended for you to get, and there is an immunization schedule to follow. We do want to make sure that you are informed about the immunizations that you are, or you are informing the patient or the parent about the immunizations, that you are administering them correctly and you know the interactions between them, keeping that good immunization record and knowing how to handle and store those vaccines. We do have our pediatric screening. We have vital signs, body measurements. We're going to do that eye and vision exam, ear and hearing, and then some other diagnostic testing in case they do come in for a sore throat or if they're having trouble peeing. We may have to do some blood drawing from them. Some pediatric diseases and disorders that you may see: asthma, lice, herpes, impetigo, ringworm, strep throat. Strep throat is one of the biggest ones, and earaches. Some of the less common: AIDS, juvenile rheumatoid arthritis, cerebral palsy, congenital heart disease. A little bit more, you have Down syndrome, Hep B, spina bifida. Some concerns that you want to really watch out for is if you detect any child abuse or neglect. Anybody in the healthcare field is considered a mandatory reporter. You want to make sure that you are reporting that. If you see any signs of eating disorders, that they have issues with their weight, that they don't eat very much, we may need to kind of talk about that. If you see any signs of depression, substance abuse, or addiction, we need to get a hold of it and maybe send to a counselor, and going that next step for that psychological eval. You may see violence, suicide, and even that sexually transmitted infections and pregnancy prevention. We need to start talking about pregnancy prevention a lot sooner. It's hard whenever you don't want parents to be talking to the kids about it, but we have to put that information out there, especially whenever they get to certain ages. Okay, that is assisting with pediatrics. We will, in the skills lab, learn how to do vital signs, learn how to measure. We will be doing the Snellen chart, which is the eye chart, looking in ears, looking in eyes, all of that sort of things when we do physical assessment. Okay, we're going to move on to chapter 41. Okay, this is a pretty short chapter. I mean, this is the major assessment that we are going to be doing as our geriatrics, but really assisting with them whenever they do come into the office. So geriatrician is a specialist for care of the elderly patient. There are many physical changes that do happen in our older patients. Their skin does get looser. They lose a lot of body fat. Their nervous system, their senses kind of deplete a little bit. Their musculoskeletal system, they are not going to be as strong. Cardiovascular system, their heart is going to start giving them a little bit of trouble. They're not going to be pumping as well. Their respiratory system, they may have asthma, they may have COPD. They may lose that elasticity of the lungs. So they may even get that curvature. So it's called kyphosis. They may get that curvature of their lungs so they don't expand properly. So they do have increased shortness of breath. We have our immune systems. A lot of times they do deplete. They're not as kept up. Digestive system, sometimes most older adults don't like to eat very much. And so those that are taking pain medication, they may have some issues with going to the bathroom. So we have to make sure that we are keeping on that. Urinary system, a lot of older guys have issues with their prostate. So it kind of pinches their urethra and they're not able to pee as well. And then their endocrine system is all their hormones. Their thyroid function may decrease. Females usually lose estrogen. Your aldosterone regulates blood pressure, so your blood pressure may be going all over the place. And then you have your cognitive intellectual development. So a lot of times whenever we do get older, we start to forget some things. We tend to not be able to take in as much information anymore. You have your psycho-emotional development. As you get older, a lot of times our friends are dying off. and we don't have our friends anymore, and our loved one, our spouse may be passing away. So we have to really look at that emotional aspect of it, because a lot of our older adults do get depressed. Now, some diseases and disorders that you are going to see within your medical assistant career is Alzheimer's. You see arthritis, cancers, cardiovascular disease, cataracts. Diabetes is a big one because it normally does come on usually in the 50s, 60s years old. Hypertension, hyperlipidemia, which is high cholesterol or high fat. Osteomalacia, osteoporosis. Now, really assisting with the care, you're going to really educate, and our education mainly is going to be based on safety. We want to make sure that they are safe. We want to make sure that they're taking care of themselves. And we also want to make sure that they are not going into that depressive state. They may be in denial or even confusion of getting older, may become incontinent. There is preventative medication out there that can slow a lot of those disease processes. We want to make sure that they are in compliance with taking their medications. A lot of older patients, they feel, oh, well, I feel better. I don't have to take it anymore. We want to make sure that they understand the importance of taking their medications and adhering to their medical regimen. We may be collecting urine specimens. It may be a little bit harder because they may not be able to pee whenever you need it. They may have a prolapse. They may have BPH. We need to kind of go around that. We may have to do some other, maneuvers to get that urine specimen if we need to. Blood drawing, their skin is really, really thin, so we really have to be careful when we are using the tourniquet. A lot of them may be on blood thinners, so we have to be careful to make sure to hold pressure for a little bit longer. Nutrition is big because you don't heal if you don't have the correct nutrition. And then even as an older adult, you are getting the immunizations, you are getting that pneumonia vaccine, you are getting that flu vaccine to help decrease your chances of getting those diseases or those infections to where it is not making that older person incapable of living. Some special concerns, our main one is falling. As we get older, our bones and our muscles don't work like they should. Depression is a real thing in older people, especially whenever they start losing their loved ones or losing people around them. Elder abuse does happen also. People financially take older people's money. They will abuse them, not take care of them, and even emotionally. And then you have your polypharmacy where they're taking multiple medications, sometimes for the same disorder because they had to go see a specialist and that specialist wanted that med. So we have to make sure that we kind of hone it down and that maybe they're just seeing one doctor for one medication and that one doctor is controlling all of their medication. Okay, that is it for lecture 2. So it's chapter 39, 40, 41. We'll be working a little bit more in the skills lab this week. So I will see you when you come in.